You know, there's one great thing about Cincinnati. A lot of people call it the family, and the way we hang out together, the way the residents get along together. You'll feel it when you come and visit. It's a very special place. We take care of each other. You know, the senior level residents, they're looking out for the junior residents and the younger people.
In my mind, the two greatest things about this place are the clinical training and the people. The people are what make this place such a great place to work and kind of build a career.
I went around to many different places, and the one thing that impressed me was the camaraderie among the residents, the sense of family that everybody has, the sense of responsibility. We work very hard over here, but on the other hand, we're all very close. We like each other very much. We're all very supportive of each other.
You know, residency is one of the hardest times in your life, in that you're just really busy and learning so much so quickly, that it's wonderful to have this family of residents who is going through this process with you, who understands the day-to-day workings of the department and the things that you're going through.
And as you go along in the residency, you really get to know the other classes and realize that they integrate into your family just as much as you initially thought just your class was that family, but you realize you really have a group of 40, 50 other people who are just as much there to support you, to make you a better doctor.
I do feel like there's a lot of camaraderie between the different classes as well as the attendings. They have us over for different functions. I've gotten to know a lot of the nurses and do things with them outside of work.
Everybody works together all the time. I get pulled in to back up R2s. The R3s work very closely with the R2s. I supervise the R1s, so everyone knows everybody, and so you're working together, and it's not just you on your own seeing your patients. It's very collaborative even within the department.
You oftentimes see our fourth years seeking out our first years and second years when there's an interesting case out there, rather than going to an off service or something like that to try to get that experience. It really, our own residents are teaching our own residents, which is a strength of our program.
Truly and honestly, as an R1, I felt like the second and the third and fourth years wanted to teach me, wanted to show me, wanted to make me better. And as the years go on, I have an immense responsibility to provide that for the junior residents.
Each class is very close. All the residents get along so well with each other. I really believe that the faculty and the residents have a great relationship. And ultimately, when it came to looking for other jobs, that was one of the tough things about considering leaving, and ultimately what kept me here was the fact that the people here are just fantastic.
There is one thing about this place that has maintained since the 70s when it started. There's a familial attitude about this department. The residency, it's the jewel. It will not be compromised. We look out for each other, we train each other, we care about each other.